Hello, good morning. I'm Dr. Kalyani, your general physician. Today we are here to discuss about adult vaccination. The saddest part of this topic is only 12% of public knows of this topic, and sadly only 4% of the adults are really vaccinated in India. So I request you to take responsibility to share this video in all your groups so that somebody may get motivated to vaccinate their parents. Over the years, your parents age, the immunity weakens, and it is called immunosenescence. At old age, if your parents fall sick and get admitted to hospital, it's very difficult for them mentally and physically for enduring such events. Your parents have got you vaccinated for 15 long years so that you don't fall sick or ill or succumb to any disease. They have spent money irrespective of their financial state. Now it's time to repay the same. Remember, prevention is better than cure.
Good morning everyone. My name is Dr. Sivanvesh Arsavalli, Consultant Critical Care Medicine, GEMS Hospital, Ragolu, Srikakulam. Today we are going to discuss about adult vaccines. Coming to influenza vaccine, it is a seasonal virus and mutates every year. Best time for vaccination is September to December. There are two types of influenzas, influenza A and influenza B, and types of vaccines available are injectable vaccine and nasal spray. High risk group are hypertension, diabetes, coronary artery disease, chronic kidney disease, chronic liver disease, asthma, and chronic lung diseases, and immunocompromised patients and healthcare workers. CDC and WHO recommendation are for more than 65 years. GEMS recommendation is more than 45 years with above diseases. Coming to pneumococcal vaccine, pneumonia is an infection of the lungs that may be life-threatening, sometimes in children, older adults, adults with chronic diseases caused by bacteria, virus, fungal, and aspiration. It may cause sepsis, leads to the death. These are all vaccines available in universal. In India, PCV 13 and PPSV 23 are available. This is the chest X-ray showing right upper lobe pneumonia. High risk group for pneumonia are the hypertension, diabetes, coronary artery disease, and chronic kidney disease, chronic lung disease, asthma, immunocompromised, healthcare workers, smokers, alcoholic, organ transplant recipients, and cancer or chemotherapy. As per CDC or WHO recommendation for more than 65 years age group, GEMS recommendation is more than 45 years with above diseases. Dosage is a typical recommendation is first dose Prenver 13, 1 year later Prenver 23, followed by booster dose for 5 years. Coming to shingles vaccine, herpes zoster is a painful viral infection, the same virus that causes chickenpox. After a person recovers from chickenpox, the virus does not leave the body. It stays dormant in the nerve cells of the spinal cord. Many years later, due to age, stress, weak immunity, or illness, the virus can reactivate, causing illness. This is the image showing a herpes zoster causing at a dermatomal level. High risk group are previous chickenpox infection, hypertension, diabetes, coronary artery disease, chronic kidney disease, chronic liver disease, chronic lung disease, asthma, immunocompromised people, smokers, alcoholic, healthcare workers, organ transplant recipients, and cancer and chemotherapy. As per CDC or WHO recommendation for more than 50 years, GEMS recommendation also more than 50 years with above diseases. Coming to MMR vaccine, the MMR vaccine protects against 3 viral diseases. These are measles, mumps, rubella. This image shows one is measles, another one is mumps, and third one is rubella. High risk groups are, it is same previous to shingles or herpes zoster. As per CDC or WHO recommendation for more than 65 years, GEMS recommendation is those who born before 1980 should take 2 doses of this vaccine, 45 years with comorbidities. Coming to TDAP vaccine, TDAP is a single dose booster vaccine that protects against tetanus, diphtheria, pertussis. TDAP vaccine is an inactivated vaccine. There are 2 types, Bostrix and Adacil. These are images showing first one is the tetanus, second one is diphtheria, third one is pertussis. High risk groups are the hypertension, diabetes, coronary artery disease, CKD, chronic liver disease, immunocompromised people, and transplant and cancer and chemotherapy, autoimmune diseases, and dirty wounds. CDC or WHO recommended adults and 11 to 18 years. GEMS recommendation is adults more than 19 years who have never had TDAP and pregnant women. Coming to HPV vaccine, human papilloma virus is a common virus transmitted through skin to skin or sexual contact. It prevents cervical cancer, anal cancer, penile cancer, and genital warts oral cancer. Cervical cancer is the second most common cancer in Indian women. Types of HPV vaccines are Gardasil 4 and Gardasil 9. These are the images showing cervical cancer and penile cancer and genital warts. And high risk groups are women aged between 15 to 26 years, unvaccinated earlier, immunocompromised individuals, men who have sex with men, people with multiple sexual partners, sex workers, genital warts, and cervical in situ lesions. CDC or WHO recommendation are routine 9 to 14 years, GIMS recommendation preferably before sexual contact, Gardasil 4 only for girls, Gardasil 9 is for both boys and girls. Coming to Japanese encephalitis vaccine, Japanese encephalitis is a viral infection caused by Japanese encephalitis virus transmitted primarily by Culex mosquitoes. Rabies vaccine, rabies is almost 100% fatal but 100% preventable with timely vaccination. India reports the highest number of rabies deaths globally. Once you succumb to rabies, there is no treatment, death is inevitable, so prevention is the best. Any wild animal bite or scratch, you should take rabies vaccine. High risk group are veterinaries, animal handlers, dogs catchers, laboratory workers handling rabies virus, wildlife workers, children with frequent dog exposure, travelers to high risk rural areas, mass gatherings like Kumbh Mela and trekkers. CDC or WHO recommended there is a scheduled vaccination is available day 0 and day 7, total 2 doses intradermal or intramuscular. GEMS recommendation is no routine booster needed for general public, only for high risk professionals after antibody testing or every 3 to 5 years. Coming to typhoid vaccine, typhoid is a common in India due to contaminated food and water. Regions or countries where typhoid vaccine is recommended are South Asia, Southeast Asian region and other areas. High risk group are food handlers, healthcare workers, travelers, people living in areas with poor sanitation, people with frequent consumption of street food, mass gatherings like Kumbh Mela and pilgrimages, anyone traveling to typhoid endemic areas like South Asia and Africa, microbiology labs. CDC or WHO recommended TCV single intramuscular dose or VAPS single dose booster every 3 years. GEMS recommendation is TCV is preferred because it provides longer protection, stronger immune response, safe in all adults. No booster is required. Coming to polio vaccine, polio is a highly contagious viral disease caused by polio virus which primarily affects the nervous system, potentially causing permanent paralysis and sometimes death. Transmits by fecal-oral route mainly through contaminated water or food. High risk group are high risk Afghanistan, Pakistan. Moderate risk group are Nigeria, Democratic Republic of Congo, Ethiopia, Angola, Yemen, and working in healthcare or lab settings with polio risk. CDC or WHO recommended unvaccinated or incompletely vaccinated adults 3 doses of IPV, booster dose for previously vaccinated adults. GEMS recommendation is IPV, inactivated polio vaccine, only recommended for adults today, pregnant women, immunocompromised. OPV, not recommended for routine use in adults. Coming to COVID vaccine, as of mid-2025, even with a rise in COVID-19 cases, health experts have suggested there is no urgent need for renewed mass booster campaign across the entire population unless and until an outbreak occurs with a new strain. It is recommended to check yearly for new strain based vaccine. Coming to hepatitis A and B vaccine, hepatitis is inflammation of the liver caused by viral infections, but it can also result from alcohol, drugs, toxins, or autoimmune disease. There are 5 types of hepatitis: hepatitis A, hepatitis B, hepatitis C, hepatitis D, and hepatitis E. Most common is hepatitis B. It is a cirrhosis of liver, most commonly caused by hepatitis B virus. And high risk group are newborns, unvaccinated adults at risk, healthcare workers, diabetics, chronic liver disease, multiple sexual partners, travelers. As per CDC or WHO recommendation, HAV 2 doses, HBV adults and HEV are recommended at 0-1-6 months. GEMS recommendation is hepatitis B virus for general population, HAV for high risk group and hepatitis E virus for limited usage. Coming to meningococcal vaccine, meningococcal disease is a serious bacterial infection caused by Neisseria meningitidis. Types of vaccines are MEN ACWY and MEN B vaccine. High risk group are people with certain medical conditions are asthenia, complement deficiency, travelers to high risk regions, sub-Saharan Africa, has pilgrimage in Saudi Arabia, outbreak settings like military camps. CDC or WHO recommended MEN ACWY, MEN B, and GEMS recommendation is both MEN ACWY and MEN B as both cover different strain. For vaccination in non-communicable diseases like coronary artery disease, cerebrovascular accident, CKD, lung diseases, hypertension and diabetes, you can see cover the following vaccines. Except in hypertension, diabetes, we have to give extra hepatitis B vaccination. Coming to vaccination in travelers, we will cover with polio, yellow fever, meningococcal vaccines, hepatitis A, hepatitis B, typhoid, rabies, cholera, Japanese encephalitis. Yellow fever is a viral hemorrhagic fever caused by Aedes and Haemococcus mosquitoes. Vaccination recommended only for sub-Saharan Africa and South America. Vaccination in healthcare workers. Priority vaccines for healthcare workers are hepatitis B, influenza, MMR, varicella, TDAP, COVID-19 and BCG. These following are optional vaccines for healthcare workers. Coming to vaccination in pregnancy, especially live vaccines are contraindicated in pregnancy. Vaccination in lactation. Safe vaccines during lactation can be given. These 3 vaccines should be avoided in lactation: oral typhoid, yellow fever, smallpox. Vaccination in immunocompromised patients like cancer patients, solid organ transplant recipients, stem cell transplant patients, aspenia, chronic renal failure. All inactivated vaccines can be given. Vaccination in cancer patient. All inactivated vaccines are safe. All live vaccines are contraindicated. Vaccination timing. Before starting, during chemotherapy, all inactivated vaccines are okay. Give midpoint between cycles. After chemotherapy, live vaccines only after 6 months. After radiation, there is no restriction for inactivated vaccines. After stem cell transplant, start complete reactivation at 3 to 6 months. These are typical adult vaccine prices in India. You can go through. Thank you. If you want PowerPoint presentation, you can pin in the chat box. We will provide you.